Both candidates for president have their own ideas on health care. News 12's Gillian Neff takes a look at how former President Trump and Vice President Kamala Harris differ.
A glance at each of the presidential candidates' websites shows healthcare issues are among their priorities. But the difference between the two candidates is in the details.
And what the Affordable Care Act has done is eliminate the ability of insurance companies to deny people with pre-existing conditions.
Vice President Kamala Harris says she wants to expand subsidies to make health insurance more accessible. Former President Donald Trump says the Affordable Care Act, signed into law by President Obama in 2010, is too expensive.
He is not a fan of Obamacare. He does not want it, to continue.
Sacred Heart University professor Gary Rose says the issue is an example of the usual divide between Democrats who support expanded federal coverage and Republicans who favor the marketplace and private insurance.
If we can come up with a plan that's going to cost our people, our population, less money and be better health care than Obamacare, then I would absolutely do it. But until then, I'd run it as good as it can be run.
Another difference we're finding has to do with Social Security, interestingly enough, that the president wants to eliminate taxes on Social Security,
ensuring more income for seniors. But political experts say that could impact Medicare expenditures, whereas the vice president,
she would like to see Medicare expanded significantly to include home health care. But that would be obviously a very expensive ordeal as well.
As for the most contentious healthcare topic,
this is an issue that's torn our country apart for 52 years.
Abortion access, especially since the Supreme Court overturned Roe v. Wade in 2022.
And now in over 20 states, there are Trump abortion bans, which make it criminal for a doctor or nurse to provide health care that make no exception even for rape and incest.
Each individual state is voting. It's the vote of the people now. It's not tied up in the federal government.
There are some big differences when it comes to the health care issues, and the voters will have if they read their platforms and look into the way they feel about these issues, I think they'll have distinct choices on Election Day.
I'm health reporter Gillian Neff, and that's your News 12 Health Report.
So where do the candidates agree? Professor Rose says both Trump and Harris promised to take steps to lower the cost of prescription drugs and help veterans returning home.